Hi everyone, this is Nafis and welcome to another episode of Medical Mayhem. This episode is called Burning Up, so let's get right into it. A 6-year-old boy presents with an 8-day history of a fever and a rash. The patient first spiked a fever of 38.6 degrees Celsius, and his mother gave him Tylenol at the time, which provided no improvement. The fevers have remained constant since then, occasionally going up to as high as 39 degrees. About 3 days ago, his mother noticed a rash had erupted all over his trunk, and quite a bit of redness had shown up in his palms. At around that same time, his eyes became very red. The child had been quite lethargic over the past few days, and this has only been getting worse. On exam, his vitals were as follows. He was febrile with a temperature of 38.7 degrees Celsius, tachycardic with an elevated heart rate of 145 beats per minute, and the blood pressure was 100/60 with a respiratory rate of 22 breaths per minute, and he was satting 98% on room air. The conjunctiva were deep red and injected bilaterally. The lips were dry and cracked in appearance. The oropharyngeal mucosa was hyperemic, and the tongue also appeared swollen and red. The palms were also red. Examination of the neck revealed lymphadenopathy of the anterior cervical nodes. There was an erythematous, blanching macular rash all over the trunk. So what's going on here? Anytime you have a kid that's had a fever for more than 5 days, the first thing you should want to rule out is something nasty called Kawasaki disease. Kawasaki disease is an autoimmune condition, typically showing up in children, that's considered a medium vessel vasculitis, where for no clear reason, your immune system starts attacking the medium-sized blood vessels in your body. When the walls of the blood vessels get damaged, the vessels can either spill out blood or form clots that block off blood flow. There's one particular type of medium-sized vessel in your body where you really wouldn't want this to happen. Think about it, and I'll get back to it in a second. So when the medium vessels are getting inflamed, where do you think that would show up? The mouth, for one, is very vascularized. You see it in the lips as they start looking cracked and dry, and there's all that redness in the mouth itself. Most apparent of all is the tongue, which is enlarged and red. It looks peculiarly like a strawberry, and that's exactly what the sign is called, a strawberry tongue. You also see a deep red appearance of both eyes as the disease causes significant inflammation of the eye vessels that leads to notable conjunctivitis. Viral conjunctivitis tends to only affect one eye, so if it's bilateral, that's a sign that there's something else going on. You also see it in the palms of the hands and soles of the feet, which develop a very red appearance as well. Finally, all the inflammation makes the lymph nodes swell up, but the lymphadenopathy tends to be restricted to the anterior cervical chain. The disease is also associated with a blanching, erythematous macular rash that can be present all over the kid's trunk. In black patients, this can actually be very subtle. Here's a side-by-side comparison of what the rash looks like in a black patient versus a white patient with Kawasaki disease. The diagnostic criteria for Kawasaki's can be summarized as a fever of greater than 5 days, conjunctivitis, rash, cervical lymphadenopathy, mucositis including a strawberry tongue, and extremity changes, typically manifesting as a redness of the palms and soles. There's another thing that can happen with Kawasaki disease that I told you to think about. Have you come up with an answer yet? What medium-sized vessel would be particularly devastating if it became inflamed and a blood clot formed as a result? That would be the coronary vessels. In Kawasaki disease, the coronary vessels can become inflamed, and that prevents blood from getting to the heart. So you can have a 6-year-old that's literally having a heart attack. That's how crazy this condition can get. What's the number one medicine you think about giving someone to prevent a heart attack? Aspirin, of course. We give the kid a high dose of aspirin to prevent this complication. On top of aspirin, we have to give the patient something to make their immune system chill out a little bit. The usual go-to is something called IVIG, where we infuse antibodies into the patient that actually calms down their immune system, possibly by attacking the patient's antibodies that are causing trouble. So let's say we provide a single infusion of IVIG administered over 8 to 12 hours, along with a high dose of 50 milligrams per kilogram per day of aspirin to make sure the little guy isn't getting a heart attack, and then monitor the patient for another 24 hours. Slowly but surely, his fever begins to come down. When the fever has been absent for 48 hours, we can relax a little bit and switch him over to a low dose of aspirin of about 3 milligrams per kilogram per day for about 4 to 6 weeks. Let's say we send the patient home and see them for follow-up after 6 weeks, and their symptoms have entirely resolved with no signs of recurrence whatsoever. That's all fantastic, but knowing what the condition does to the heart, we should look at the echocardiogram to make sure everything is okay. If it looks fine, we can discontinue the aspirin and we're all good. But when we do the echo, we see this. Both the right coronary and left anterior descending arteries have become dilated. This is a complication of Kawasaki disease known as coronary artery aneurysms. Basically, as the immune system damages the coronary vessel walls, they start to weaken and form outpouchings as a result. These are aneurysms. When blood's flowing through the vessels, it tends to pool up in the aneurysm, which can result in a clot forming. If a clot forms in one of the coronary vessels, well, that's when we get this dreaded complication we were so worried about, a heart attack. Since these coronary aneurysms remain, that means that the risk of a heart attack isn't going away, and therefore we can't take the patient off aspirin anytime soon. He's in it for the long haul. The patient will continue taking aspirin over the longer term, and we can reassess with another echo at a later date to see if the aneurysm remodels to a normal size. The patient presents again 2 months later with a 3-day history of nausea and vomiting. He's had 10 episodes of vomiting yesterday and has grown quite lethargic, staying on the couch and becoming less responsive to his parents. His mother thinks he's become more confused and is not acting like his normal self. On exam, he appears confused and lethargic. He's not oriented to time, place, or person, and he's not obeying commands. He was tachycardic and tachypnic. Abdominal exam revealed an enlarged liver. So that doesn't sound very good. This little guy is clearly not well. We're able to palpate an enlarged liver, so maybe there's something going on with that. Let's get some blood work and find out. Here are some labs for us to look at. I want to point your attention to what's on the right, the liver biomarkers. You can see the liver transaminases AST and ALT are markedly elevated, indicating that there's some liver damage going on. The ammonia is also elevated. The liver normally takes care of ammonia by converting it to urea that can be excreted by the kidney, but instead it looks like it's building up. That means the liver is getting so damaged that it can't take care of ammonia the way that it should. When ammonia levels in the blood get too high, they can get to the brain and cause encephalopathy. That looks to be what's happening here, as this kid is confused to the point where he doesn't even know who he is. There's another function of the liver that's obviously impaired right now. Maybe you noticed it. The glucose is horrendously low. This pronounced hypoglycemia is because the liver is normally responsible for gluconeogenesis. It takes stuff like glycerol, amino acids, and lactate and spits out glucose. When the liver is shot, the liver isn't such a good glucose factory and the levels go down. The hypoglycemia that results contributes to the altered mental status and can ultimately result in seizures and a coma. One more thing. The bicarb is low because the liver normally clears lactic acid from the blood. Since it can't do this, the lactic acid builds up, causing metabolic acidosis and therefore low bicarb. Now that we've established something's going on with the liver, what is it? Remember that he's been taking aspirin for a while now. See, you shouldn't normally give aspirin to children. In fact, you're usually advised to avoid it like the plague in kids. But the one exception is Kawasaki disease because, well, a heart attack in a kid would be really, really bad. But why don't you normally give a kid aspirin? It's because in kids, aspirin attacks the mitochondria of the liver. What do the mitochondria do? Everyone knows this one. It's the powerhouse of the cell. Specifically, it produces energy in the form of ATP, and one way it does this is by breaking down fatty acids. Aspirin inhibits the ability of mitochondria and liver cells to break down fatty acids, and the fatty acids build up, and all that fatty acid accumulation leads to one big fatty liver, aka hepatic steatosis. This phenomenon is called Rye Syndrome. For reasons that are not all that clear, this effect is seen in kids and not so much in adults. Let's get an ultrasound of the liver and see what we're dealing with. Here you can see multiple hyperechoic lesions of the right liver lobe, which is consistent with severe hepatic steatosis. The same is true for the CT. In summary, a fever of greater than 5 days in a child is highly indicative of Kawasaki disease. Other symptoms to look out for include mucositis, such as the development of a strawberry tongue, cervical lymphadenopathy, and redness in the palms and soles. Kawasaki disease is also associated with the development of coronary artery aneurysms, which is one of the dreaded complications. Treatment for Kawasaki's is typically aspirin to protect the coronary arteries, but one of the dangerous effects of this is Rye Syndrome, which is the development of a fatty liver due to the mitochondrial dysfunction induced by aspirin when given to a child. Thank you very much for watching this episode of Medical Mayhem. If you enjoyed it, please like the video, share it with your friends, and subscribe to the channel. Until next time, this is Medical Mayhem.